Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott. June has been designated by the White House and the United States Congress as Men's Health Month. In fact, Dr. David Gremilon of the Men's Health Network has indicated that we're facing a silent crisis when it comes to men's health in the United States. In Dr. Gremilon's words, men in this country tend to live sicker and die younger. And this is something we're trying to improve here on Health Focus by casting light on all issues relative to men's health as Men's Health Month is upon us. And we're very fortunate to have with us a member of the Board of Advisors of the Men's Health Network, a good friend of Health Focus who's been with us before, Armin Brott. Thanks for coming back, Armin. It's really a pleasure to have you back.
Great to be here. Thanks for having me.
And with respect to Men's Health Month, tell us a little bit about how this particular organization that you're on the Board of Advisors of fosters men's health. What is the organization about, and what do you do?
Well, Men's Health Network has been around for about 25 years, 26 years almost, and the mission is basically to do education and outreach and provide speakers and provide resources and all sorts of different kinds of materials on every aspect of men's health. And we try to reach men. The slogan that we've got is that we try to reach men where they live, work, play, and pray. So we do faith-based outreach, we do outreach to members of Congress. We were very involved in setting up within Congress a bipartisan men's health caucus to get the members to focus on men's health and to understand that. So we are try to be as many places as we possibly can with as many helpful resources, and it's really all about educating the public and men themselves on how to take better care of themselves.
And I think this is very timely because even though the survival and longevity of Americans has tended to increase throughout the 20th century and early 21st century, we're seeing a downtick that's quite alarming, particularly among older men, where some studies have indicated longevity may even be declining, perhaps due to things such as opioid overdoses, depression, suicide, and other factors. But this is something that's very disconcerting. Do you think Dr. Gremilon is on target when he says we're facing a crisis here, or is that a little too much rhetoric? What do you think?
No, I think we've been facing a crisis for quite some time. I mean, right now, men live 5 years less, 5 years shorter lifespan than women do overall. So that's a pretty big deal. And I think if it were reversed, we would have a major health crisis, and the public health industry and the public health infrastructure in this country would know exactly what to do, what resources to mobilize to deal with a crisis in women's health if women were dying 5 years younger than men. But because I don't know if to say necessarily that because it's men, but it happens to be men, and we're not really focusing on it. And men have not typically been terribly good about asking for help when we need it. I mean, that's part of the whole macho thing, or the provider protector thing, or big boys don't cry. We're not going to complain about our things, and that's one of the biggest issues is that men don't go to the doctor. I mean, you probably saw that or see that in your own practices. Men tend to show up later in a disease progression than women do, which means that their prognosis is shortened.
Right, and I think that to some extent, because there are hormonal differences between men and women, such as higher levels of androgen or male sex hormones in men, some of the earlier mortality in men is going to be very difficult to ever completely overcome, in the sense that men have tended to have shorter lifespans than women, as far back, I believe, as we've had records. So,
well, in about 1900, the difference in lifespan was only 1 year. And then it grew to 7 years, and then it started to shorten for a couple of years there, and then now it is beginning, as you said, it is coming back up again. And a lot of that does have to do with the opiate addiction, that something like 70% or 75% of opiate overdose deaths are male. Is another thing that we don't hear a lot about, and mental health is another huge thing, and which is also disproportionately affecting guys like us.
Yeah.
I mean, our general age group of men, where 75% of all suicides are male.
Right.
And I remember having a conversation with one of the directors of the Marin County Health Department who said what I said before, that if this were reversed, we would know exactly what to do. But we as a society don't know what to do. And part of it is that men are inclined to do riskier things. That's part of it. But part of it is also that there are other issues. Why is it that we're more affected by heart disease and diabetes and a lot of it's education, and that's what we try to do at Men's Health Network.
I think that's a very laudable goal. In the year 1900, the number one causes of death were primarily infectious diseases, tuberculosis and influenza, for example, and I believe the lifespan in the United States was 49 years.
Yeah.
So the 1 year would be less, but as a percentage of the lifespan, the difference would not be quite as dramatic, although still quite impressive. I agree with you completely. And yeah, if we can make both genders, both sexes live longer and have healthier lives, that's really an admirable goal.
Yeah.
I think in the United States, the cause of death is actually changing also. For example, in 22 states, including California, cancer deaths have surpassed heart disease as the number one cause of death. Both heart disease and cancer are decreasing in terms of their effect on survival, but the drop-off for heart disease has been much more dramatic due to the advent of medications for hypertension and cholesterol lowering, so that these death statistics become really complicated. But you hit on some important areas for men specifically where we're focusing. You mentioned, for example, mental health related issues, the reluctance to go to healthcare providers. So the Men's Health Network, how does it try to improve this? Does it reach out through formal activities, obviously through shows like ours, but
Sure.
what other sorts of things is the Men's Health Network involved in?
Well, I've been involved as a writer in producing a lot of written materials. So this is one of our best known books I think we've given out several 100,000 of these. Blueprint for Men's Health talks about all different aspects of men's health. And then this one is Your Head and Owner's Manual, which deals with mental health issues for men. So we produce a lot of written materials that we make available to be given out for free, and they're adopted by a lot of health departments. This the Your Head book for mental health was adopted by the Customs and Border Patrol, Department of Homeland Security. So we're trying to get that kind of information out. We also do individual programming. I mean, we work with NFL teams and Major League Baseball teams to put on physical screenings at stadiums, which tends to bring a lot of guys in when we can put out a poster and we can do some public service announcements and say, hey, we're having an event at the Washington Redskins stadium, and you can come and you can go in the locker room and see where the guys are. And we had some cheerleaders come to one of the events, and the guys can get their blood pressure checked and have a prostate test and do some grip strength, which is an indication of a lot of health issues for men. So we do those kinds of things. And then also, I mentioned just before we went on the air, that Men's Health Network just put on a big conference in DC about men's mental health and looking at screening tools in particular, about the screening tools that are available to flag mental health issues the questions tend to be phrased in a way that's going to flag more female things about, do you cry a lot? Do you have difficulty concentrating? And more male mental health symptoms tend to be, are you angry a lot? Do you work too much? But those don't get flagged as mental health, those get flagged as anger issues. And so we aren't recognizing the things that end up with that 75% male suicide rate, which we believe could be helped if we had better screening tools that were going to be looking at things from a male perspective. So there's a lot of that.
Yes, and I know that you're just mentioning some of these publications, but I think that I should point out to our viewing audience that you're a prolific author. And I believe that writing, as well as reaching out to the public as a radio host, I believe with KOIT most recently, and also on the military health...
it's called the American Forces Network. Yeah, it's all of the military radio stations,
right,
which is somewhere between 200 and 400 of them. Yeah,
right. So your voice is known to many members of the public, as well as your opinions through your publications. And I believe that your publications have covered men's health issues from particularly with respect to fatherhood.
Yeah.
And we have a few of your publications here, and I believe you have one that's new.
I do.
Maybe you could tell us a little bit about it. I think it in fact deals with the earlier part of fatherhood. Can you tell us a little bit about this, Armin?
Sure. Well, it started off with this one, The Expectant Father, which deals with pregnancy and childbirth, and then this one is the first year, so dealing with the first 12 months, and so there's a whole series of them.
Okay, so let's start with this one then.
Okay.
The Expectant Father was the first one.
Right. That was my first book that came out. The first edition of it came out 20 plus years ago, and that's how I got actually involved with the Men's Health Network in the first place, is got a call from somebody saying...
Does being an expectant father affect the health of men in any respect?
You know, in the most fascinating ways.
Okay, tell us.
I'll tell you, I mean, the expectant fathers and new fathers tend to be less involved in criminal activity. They tend to take better care of themselves. They tend to abuse drugs and alcohol less. They also tend to be better performers on the job, which has effects in many areas of their lives. I mean, I remember just on a personal story, and I tell this to the guys I teach classes for expectant fathers, that when you find out you're going to be expecting a baby, the way you look at the world changes. And one of the ways I looked at the world is I started seeing yellow lights as something I should maybe think about stopping for, instead of flooring it to see if I could get through. And I mean, just that sort of a simple thing, for me, it probably saved some accidents. And there were probably not my life spared, but other people's as well. And so I talked to a lot of guys who've sold their Harleys and stopped bungee jumping and quit smoking and things like that. So definitely there are some health effects, yeah.
And also being a good father during the period in which your wife is expecting has implications for the future health of the baby that is on the way, obviously, too.
Yeah.
So this is your first book?
That was the first book,
okay.
Right.
What was your second book?
The New Father, Dad's Guide to the First Year, which, as you might expect from the name, deals with the first 12 months. So it was really that all-important period when the relationships begin to form between the father and the child.
Important for the child and the father alike.
And the father and the relationship as well. So it takes the dads through everything that is going on with the child developmentally, and also what's going on with them, which is really my focus on all these books, is what's going on with you. How do you understand how your life is changing, and how the weird things that you may be thinking, and how do you form a relationship with your child at any particular stage? Because there are differences.
I tend to think, just anecdotally, from what I've seen in my own practice, that fathers who are taking care of younger kids, they tend to have their sleep patterns disrupted. Often they don't go to the gym as often. They tend to put on a few pounds,
yeah,
get a little bit out of shape.
The famous dad bod, yeah.
Yeah. Maybe that's something that's worth thinking about. Do you address that sort of issue here at all in the book?
Yeah. I mean, I talk about the importance of staying in shape and setting a good example for your kids.
Excellent.
And just, I mean, you need to do that for yourself. I mean, just think of all the lifting and twisting and schlepping and dragging and everything. Your back is going to give out on you. If you can get in some core exercise training, you're going to be able to deal with babies a lot easier.
Absolutely. And Armin, how about your most recent book?
So this one just came out within the past couple of weeks.
So it's hot off the press. We're on the cutting edge here at Health Focus.
We are.
Tell us about it.
The New Father, Dad's Guide to the Toddler Years, so it follows up from there. And it was a complete rewrite. It's the third edition, a complete rewrite of the previous edition. And really some of the most fascinating things about technology and kids and toddlers in particular. And how, as technologically adept as most of us are, we might want to keep our kids away from it for a little while longer. That the pediatricians I talked to when doing research for the book were telling me that they're seeing little kids who are, you see, YouTube is filled with videos of kids swiping, and it's all very cute, and you say, oh, how lovely. But then you hear the pediatricians and they say, but these kids have poor muscle tone and poor hand-eye coordination than kids used to 20 years ago, because they're dragging something from over here, a block from here to there, and letting it go, and it balances on the screen. But if you had to pick up a block and put it on top of another one, that's a whole different thing.
Yeah, I think it's very bad
it up,
in many respects, excuse me for interrupting, but neurocognitively, also just for the health of your eyes. I think that when you are focusing on something very close to you excessively at a young age, I think it could cause eye strain.
Yeah.
There is some epidemiological data to suggest that rates of nearsightedness do rise a bit with prolonged up-close activity, particularly starting in childhood.
Makes sense, yeah.
So, yeah, I think that's very important. And I understand these books have done well, that they've sold quite a bit.
They've sold more than 2 million copies, which is, I don't even know what to make of that exactly. It's a lot of copies of books, but they're continually new fathers being born every day. And so I feel that I need to continually update them and make sure that I'm getting the most accurate and helpful information for the guys who are buying the books. And I should say not just the guys who are buying their books, but there's a lot of moms and mothers-in-laws and grandmothers and people like that who are buying them for guys.
And share with us, Armin, a little bit about how you got into this field. I understand that you took a sort of non-traditional path to becoming really an expert on fatherhood. and that, in fact, it involved some time in the military and a lot of other experiences. Can you tell us a little bit about yourself and how you fell into this area of interest?
Well, I fell into this whole thing mostly because I'm a malcontent in many ways, and when my first one wasn't quite born yet, I was looking around for information and resources and some sort of answers to the questions about all these strange thoughts I was having, and how was I going to be able to afford this, and was I going to be like my dad or not like my dad, and there was nothing out there. And so I started writing snippy essays about the lack of portrayal of fathers in children's literature, and why men don't take paternity leave when they have the opportunities. And eventually that became the expectant father. I ended up having to create the books that I wish I would have had when I needed them. And so they have become, fortunately enough for me, that they become the books that a lot of other guys get to have when they need them.
And some of the military people that you interact with on your show, and I understand you're a former Marine yourself, as I recall. Never an ex-Marine, only a former
You can't
Marine.
be a former,
yes.
Yeah.
They also reach out to you, and I understand some of the issues involved, for example, deployment, the stress of deployment. Yeah. Having been in the military myself, although I was, fortunate I was a commissioned officer, I had perhaps a little bit of a more cushioned environment, as it were. But if you're deployed, it could be a little bit rough, not only on you, but on your family.
Yeah. Yeah, well, I did, having done all these books, and a couple of years ago, or actually more than a couple of years ago, not long after 9/11, started getting emails from guys who were deployed in Iraq or Afghanistan or other places they couldn't tell me, and saying, I got deployed, my wife's pregnant, I'm going to come back, and I'm going to have a 9-month-old baby. What am I supposed to do? How do I maintain a relationship with that? And I'd hear from mothers who would say, my husband just got back from a deployment, and every time a door closes around here, he dives under a table. Or our little daughter came up and wanted to hug daddy from behind because she hasn't seen him for a long time, and he just turns around, he's about to throw her out her window, which is exactly the right reflex you want to have in a combat situation, but not in your living room. And so I thought, I really have to do something about that. So I wrote a book, an entire book called The Military Father, a hands-on guide for deployed dads, which talks about exactly that. How do you get ready for deployment? How do you stay in contact with your family, with your kids? How do you maintain relationships? And then, and I want to say most importantly, because those getting ready for it and during deployment are important, but what happens when you come back? You're not the same guy you were when you left, and your family's not the same family. They figured out how to do everything without you. Not that they don't need you anymore, but they know how to take the trash out, and somebody else is sitting in your chair with the remote.
And of course, now that we're seeing the conflicts in Iraq and to some extent in Syria, our involvement there winding down, we're going to see more younger veterans coming back. Obviously, there are men and women both in the military, but a large percentage tend to be men. Yep. So they're going to have to reintegrate into civilian life. Do they have unique challenges as men?
They have incredibly unique challenges. I mean, one of the big ones ties into what we talked about a little bit about before, having to do with mental health issues. Because acknowledging that you need help, particularly in a mental health sort of way, in the culture of the military is especially difficult. That they have made, on an official level, major strides towards reducing the stigma of seeking mental health services, but it's still there. A lot of guys are still afraid that they'll lose their security clearance, or they won't get promoted, or they'll be just drummed out altogether. And there's less of that, less reality there, but there is still a tremendous amount of stigma, especially for guys, about asking for help.
While we're on the subject of stigma, and to some extent the related issue of denial, the data from the CDC suggests that, and it's been summarized by the Men's Health Network, that among the top 10 causes of death in the United States, most of them tend to be more common. They occur earlier in men. That would include, for example, heart disease, cancer, injuries, stroke, suicide, HIV, AIDS. Obviously, there are exceptions. For example, we're all aware of the tremendous crisis for breast cancer in women, which strikes 1 in 7 women. Right. But nonetheless, there tends to be earlier mortality in men. Why doesn't the media cover this more frequently? Why don't we hear more about this?
Part of it is, I think, that men don't ask for help. We don't acknowledge that we have it. We don't go to the doctor unless something is bleeding or falling off, or unless it's a sexual issue. Then it tends to bring more guys in. I think there's part of it. And I think there's also, unfortunately, a sense that by advocating for men, or by spending, allocating resources of time and money and government programs to focus on men, that we would be taking something away from women. And I have to emphasize that every time I talk about this, that we are not talking about taking anything away from women. I think the women's groups, women's movement, the breast cancer movement has done an unbelievable job of focusing the media's attention and the public's attention on increasing awareness of women's health issues. And we need to do that as guys. We need to be modeling what we're doing on what the women have done,
right,
to do that. I mean, it's very much a rising tide lifts all boats kind of thing. It's not a seesaw that if you take something away from men, you give it to women, or you take something away from women, you give it to men. It's not. That when men are healthier, they have better relationships. When men are healthier and live longer, you have fewer women become impoverished when their husbands die. You have fewer people need government programs. You have much less loss of productivity. And just imagine, I actually did a paper on this a few years ago. It was $450 billion a year in lost tax revenues and decreased productivity from guys dying 5 years younger.
In other words, it's not a zero-sum game.
It is not.
And I can tell you that when I see men who have chronic illnesses or who are injured on the job, because I see a lot of injured workers, they often come with their spouses, and the spouses often help them to recall their medical histories. Mm-hmm. And so in that case, you might have both the injured worker being in the doctor's office and the spouse, who often, most frequently, is a woman, who took time off work to be with her husband. So an illness in a man can have an adverse effect on the entire family. And for example, 92% of workplace injuries historically tended to occur in men, although I believe that's changing, particularly with overuse injuries associated with keyboarding and office work. In my own practice seeing injured workers, I tend to see, I would say, roughly an equal number of men and women, but historically workplace injuries were more common in men. Right. So workplace safety is an important part of this whole issue of maintaining health.
Yeah, and 95 or 96% of workplace fatalities are men.
I guess that's what I was recalling from the Men's Health Network data, yeah.
Yeah, I mean, the fatalities is a big thing. And
right,
it's a tragedy, and I think we need to be doing something to work with OSHA and other organizations to make sure that we get the workplaces to be as safe as they should be.
Why are men so reluctant to see doctors?
I think it's a big boys don't cry thing. It starts with that. I mean, you hear from the time you're very young that big boys don't cry, and then when you get a little bit later and you get involved in some high school sports, you play through that, and then a little bit later after that, when you start having kids, you don't have time because you're taking care of everybody else. And just to pick one disease, diabetes, that men are diagnosed with diabetes, this is true, 15 years later than women are. So, as a doctor, if you have somebody who comes in with symptoms that have been going on only for a year, her prognosis is a lot better than a guy who comes in with 15 years of not having paid any attention to his symptoms. And we need to be doing more education, and we need to be talking to medical professionals and saying, look, here's how you can talk to men to get them to open up about stuff. You need to ask them questions in a way that's going to encourage them to talk, instead of, hey, how you doing, or I got to get to my next patient in 7 minutes.
I think we would be remiss if we did not at least also mention that there are some pretty striking differences based on ethnicity and survival. For example, data suggests that an African American male born in 2014 has a life expectancy of about 72 or 73 years, compared to almost 77 years for a white male and 81 and a half years for a white female. So we have a lot of disparities too based on different patient populations or different ethnicities.
Absolutely, yeah.
We can do better there, I think, too.
We certainly can, and some of it has to do with cultural issues, is that African Americans are less likely even than Caucasians to go to the doctor. And talking to some of our board of advisors, there's one of them, Jean Bonhomme, who's an African American physician himself, was saying that in the African American community, there's a sense that people will talk about, if you're black and you go into the hospital, well, black people don't come out, which is a horrible thing to be thinking, but it keeps people from going, and it keeps people from getting treatment and from catching things early. Some
of that may be the legacy of, for example, the Tuskegee experiments on syphilis and other things where full disclosure was not involved, and there might have been some abuse or